Groundbreaking research by the Human Science Research Council shows that nearly half of South Africans struggle with weight problems because of poor eating habits. 30-year-old Tembisa resident Sonia Ndlalane struggled to keep off the weight since having her first child.
It's not easy, I don't want to lie, because you need to make sure that you keep your fitness, on the right track. You need to make sure that whatever you eat, whatever you consume, because it does cause a big impact in your life.
Sonia, like many women, has to compromise her desire to be healthy with her family's needs as food costs rise.
In most cases, we want to lose weight, but we are trying to use whatever that we can afford, which is not easy, because if you look at your cupboard, you've got your eggs, you've got your bread, you've got your tomato, your everyday food. That can also accommodate children.
South Africa faces a growing obesity crisis fueled by the lack of affordable healthy food options, while unhealthy choices are readily available and heavily marketed. Access to fresh fruits, vegetables and whole grains remain limited and unaffordable for most.
Not only you have the concept of access to food, but you also have the time that it takes to prepare food. So you will have a single-headed houses with a mother who is working far. By the time she comes home in the evening, does she have time to prepare a healthy meal?
Food is not a luxury for millions of unemployed South Africans who survive on social grants. Desperation to survive is putting many in danger of chronic diseases.
You have, for example, a heightened risk of type 2 diabetes. You have a risk of heart diseases. And beside that, obviously, there's a quality of life that is affected, whereby the ability, the sleeping patterns are disrupted. The mobility of the person is disrupted.
Weight excess not only impacts people emotionally and physically, it costs South Africa's health system almost $1.9 billion annually.